Hello everyone, I am Dr. Mukesh Dubaria. Today I'll be talking about non-invasive prenatal testing, which is also called as NIPT. Now, what is NIPT? NIPT is a blood test that analyzes cell-free DNA in a pregnant woman's blood. Now, this DNA mostly comes from the placenta and reflects the baby's genetic material. NIPT is used to screen for common chromosomal abnormalities such as trisomy 21, 18, and 30, which are also called as Down syndrome, Edwards syndrome, and Patau syndrome. Now, depending on the test used, NIPT can also check for some sex chromosome conditions and sometimes microdeletions also. But remember, NIPT is a screening test, it is not a diagnostic test. We still have to depend on CVS and amniocentesis for confirmatory diagnosis. Now, why is the NIPT important? Chromosomal abnormalities are a major cause of pregnancy loss and birth defects around the world. Now, let's understand the science behind NIPT. The cell-free DNA that we test comes mainly from the placental trophoblastic cells, along with some DNA from the mother's own tissue. An important concept is the fetal fraction. This is the percentage of DNA in the mother's blood that comes from the placenta. A minimum fetal fraction of 4% is required for NIPT to generate a result. However, a fetal fraction of 8 to 10% is considered optimal for the test accuracy. Now, if the fetal fraction is too low, the test may become inconclusive or worse, it may give a false result. Also, since the DNA comes from the placenta, not directly from the baby, placental mosaicism can lead to differences between the NIPT result and baby's actual chromosome. NIPT is typically performed from 10 weeks gestation because by this point there is usually enough fetal DNA in the maternal bloodstream to allow for accurate analysis. Testing earlier than this increases the chance of inconclusive or inaccurate result. Now, when should we offer NIPT? See, NIPT can be offered to all pregnant individuals, those with advanced maternal age, a positive first trimester screening test, or an abnormal ultrasound. Now, today's guideline, see what today's guideline recommend that all pregnant people should be informed about both the screening and diagnostic testing, regardless of age or risk. How is NIPT done? Now, see, the test is typically performed from 10 weeks of pregnancy onward. It requires a single blood sample from the mother. The lab then uses high throughput DNA sequencing or targeted analysis to check the number of copies of each chromosomes. Now, what are the results? See, the results can be high risk or positive, low risk or negative, or there is no result. Now, a high risk result does not confirm a diagnosis. Then, if a high risk come, then we have to go for CVS or amniocentesis. But if low risk come, then that is fine. They can easily continue the pregnancy. What should we counsel the patient who are undergoing the NIPT? That NIPT cannot detect everything. First of all, NIPT, if the result comes high risk, then it does not mean that that is the diagnosis, and that incidental finding may occur, such as maternal chromosomal issues, an undiagnosed cancer, or a microdeletion, depending on the test. If the result is high risk, we should arrange for genetic counseling right away. And we must offer CVS if the pregnancy is less than 15 weeks or less, or amniocentesis when it is more than 15. Let us talk about limitation. See, NIPT is a powerful tool, but it is not perfect. False positive can happen, especially due to confined placental mosaicism. False negative may also occur when the fetal fraction is too low or when the specific condition isn't covered by the test. Also, maternal conditions like mosaicism, organ transplant, recent blood transfusion, or even undiagnosed cancer can affect the result. Now we'll talk about what are some of the new things in the field. Recent advances include expanded NIPT covering, such as microdeletions, genome-wide screening, and even single gene disorder. While these are exciting, we must be cautious. The clinical utility, false positive rate, and the complexity of counseling are still being debated. Now, how should we respond to the result to the patient? See, if the result is low risk, we continue the pregnancy as routinely advised. Now, if it is high risk, arrange for genetic counseling and offer diagnostic testing such as CVS or amniocentesis. Now, if there is no result or low fetal fraction is there, that is very low, that is less than 4 or less than optimum, that is less than 8, consider a repeat blood draw or move straight away to diagnostic testing depending on the situation. Now, let's summarize with some clear practical take home message for the patient. NIPT is a safe blood test that can reduce the need for invasive testing. A positive result means a higher chance of condition, but it is not a diagnosis. You need confirmatory testing. NIPT does not detect every genetic condition. Make sure you understand what your specific test checks for. If the result is abnormal, you will be offered specialist counseling to help you understand your option. NIPT is a revolutionary tool in prenatal care. It reduces the need for invasive testing, but it does not replace diagnostic testing. Proper counseling before and after the test is absolutely essential. Thank you.